Hi guys, Dr. Nick here. So today we're going to continue our series on LDI, low dose immunotherapy. Today I'm going to try to just summarize LDI as a whole so you get the full message in a few minutes. So as we said from the first video that we started, LDI, the goal of this therapy is to desensitize you to whatever is physically triggering you. What we're saying, there's possibly a hyperimmune response where the immune system is over-exaggerating and we want to stop that. So that's what we're trying to do. We use different types of LDIs, which can be the LDA part, like we said, allergies from the environment, chemicals, and also foods. Then we have the other branch, which is everything else you can think of in terms of LDIs, but we can even categorize them into different microbes, different, say, hormones, and different other products that we think are possible, and also autologous samples, so from ourselves. What kind of conditions can it be helpful for? Different type of allergic conditions, so for basic seasonal allergies, to autoimmune conditions, to complex chronic illness, and many other things. What we do is we try to find something called the core dose, and the way we're doing that is titrating weaker doses to get to that stronger dose that is effective for you. And then what we can do in between this 7-week period that we wait after we give a physical dose is that we can possibly give a booster if symptoms aren't 100% better for longer than a certain time. And our goal is then, once we give a dose, communicate every 7 to 10 days as we are titrating to the core dose. So once we give you the dose, you'll have the paper there, you're going to put your symptoms down, better, worse, or neutral, for how long, and how much better, of course, overall. And then we can categorize and see if we should go to another stronger dose as we're trying to find the core dose. And then again, what's the next steps after that? So like we said, we only give LDIs whenever the symptoms come back. So even if it takes longer than 2 months for symptoms to come back, then we don't give until that point, because there's no reason to, because there's nothing to treat. So that's the beauty of this therapy too. Okay, but what happens if we have a flare? So a flare, like we said before, one positive thing from it is that it tells us that whatever symptoms got worse, that this antigen or this LDA that we use can make those symptoms better. Of course, the negative is that you can get possibly worse in terms of your symptoms overall. And again, it's a sublingual medicine that we give you. It goes under the tongue or in the mouth, and it doesn't have to be injected. And then once we find the core dose, and you have some betterment from your symptoms, we wait 7 weeks until we give it again, and then we, based on what we've seen with your symptoms in terms of what has gotten better, we might add other LDIs. So I hope that summarizes LDI well for you. If you need more information on LDI, of course, you can contact me directly, even in this post. You can put a comment down if you have any questions towards that, but also you can check out my previous videos on LDI to see more information on each of the specific topics that we talked about. And again, thanks for watching. Continue to follow me, because you never know what kind of new videos I'll come up with next.